going to talk a little bit about thumbs today. We've got Scott here joining us. This is an area where, especially for a lot of massage students out there, get problems. Not even massage students, but obviously the professionals as well. Let's put it into practice. So I thought what would be really worthwhile is going through some really great release techniques here that you can do on either your clients or even on yourself for that matter. So, believe it or not, you could actually get here and do some work on it, but I'm obviously going to replicate this. I'm going to add a little bit of passive release techniques once again. You know how much I love those. We're going to try and free up the wrist joint a little bit as well and do a little bit of techniques through also the other side of the thumb as well. So we've got quite a few that we can play with here. So the first thing is we need to keep in mind the muscle, okay, or the muscles that make up this thumb area. So we've got the opponens down here, and then obviously we've got the adductor in the upper half, and they come all the way over and attach into basically the mid part of that thumb as well. So there's a big, broad amount of tissue there. This is the soft tissue that tends to give a lot of massage therapists to their problems. Not even massage therapists, anyone who's using a repetitive thumb nature, and I know Scott obviously gets a little bit of problems with that there. Okay. So really, really good technique. Make sure that you're able to get the hand nice and flat onto your table so you've got a good working platform. And what I'm going to do is I'm going to come in once again with basically not just the elbow, but a broad forearm. So we're going to drop right onto that opponens, so the lower half, okay, of that thumb musculature. Okay, so I can sink down into the tissue. So it's a sinking process. Keep the fingers out of it. And believe it or not, as much as this looks aggressive, it's actually not that aggressive, and it doesn't hurt that much at all, does it, Scott?
No,
right?
Stuart.
So should be a really broad pressure. Okay. Once again, we do have trigger points in this area here. So the idea is to focus on the trigger points. Now, trigger points in the opponens is obviously right almost in the belly of the muscle itself, which is about there, I'd say.
Yes,
is that
Stuart.
right? So what I can do here is I can just drag the tissue back towards me and across and then down, picking up all the way along the length of that tissue. Once again, sink down, gauge the tissue, and then drag back towards you. So you're coming back right towards the thumb itself. So you can pick up all that tissue as you work along there. Okay, once again, now I'm going to go up a little bit further, pick up the adductor, come down, and once again drag back towards you. How's that pressure?
That's good, Stuart.
That's good. Now, let's not miss the magic here, and the magic is those trigger points. So if we find those trigger points, let's sink down and just sit on those trigger points. And once again, like any of this trigger point work, do not come off that trigger point until you start to feel it fade. So sometimes if no one's actually had work in this area, okay, it might take a while for that just to subside a little bit. So just be patient, let it happen. It'll eventually start to fatigue, fade out, and you should start to get a nice little change through there. It almost feels like a little bit of a melt. Okay. All right, now once you've done that, then what we can do is we can come in and actually do a little bit of passive relief techniques as well. So what I like to do, I'm going to hold the hand flat like so, okay, and that's going to give me access to that thumb and move it. So once again, what I can do is I can sink onto that tissue and then start to push that thumb out to a little bit of abduction, once again, while I work through that tissue. Okay. So what you'll start to see, a little bit of trigger point work, okay, get a deactivation of those trigger points, and then come in and do these passive release techniques. Because now you can start to engage a lot more of that new passive range of movement. Okay, get the idea. Now, if we turn the hand over, obviously we've got the back hand here as well. So little muscle that obviously gets missed as well, once again, right in here as well. So we use a little bit of cream through here. Now, because it's not a huge muscle, we can actually use a little bit of our thumb to work through this tissue. But once again, it's an often missed muscle, especially for soft tissue therapists, massage therapists, but absolutely critical to the hands. So just going to come on the outside of that condyle here. We're going to sink down into the tissue, and we're going to use both thumbs and come all the way up into basically that medial surface of the thumb. So it's only a small little bit of muscle, but critical. And believe it or not, once again, if we drop it out of the way, we can come in and just sit on here for a trigger point as well. About there.
About there.
Once again, just sit on there, wait for that to just release. Now normally, once I've done all those techniques, we can come in, do a little bit of mobilising techniques as well. So what I like to do, we're going to come around the wrist itself, okay? Just check its range of movement, okay? Ulnar, radial deviation, bit of flexion extension, okay? I'm going to come above the shoulder, the wrist, okay? Grasp the lower half and the upper half, small amount of traction, and then bring it out into radial. Okay, same again, traction into ulnar. Okay, so all you're doing there is just mobilising that wrist joint. Good. Okay, and then the final process is coming across and then just opening up right through that area there. Okay, so we're going to come through there. Great, all right. Couple of tips just for thumb and hand. Now, keep in mind when you are doing these techniques, it's really important not to rush through that trigger point work. I can't emphasise that more enough. Then employ your passive release techniques.
So, if you even remotely enjoyed some of that content, please do me a favour and hit the like button below, just so that I know that you did enjoy it. Also, if you don't want to miss out on any of the content that we put up on a regular basis, then the best way to do that is obviously just to hit the subscribe button. So it's a bit of a no-brainer. But most importantly, if you really want to see the true show, the real show, take the opportunity, hit the link below, stuarthinds.com. That's where we have all the comprehensive assessment, treatment of a whole range of conditions. That's where we have our online courses and obviously our mentoring and so forth, the webinars and our podcasts. So if you're even remotely interested in what we do, go and check it out. Appreciate it. But also, most importantly, again, just be awesome at what you do.